Doctor, we have been advising this person to leave alcohol. We have been telling him the ill effects of alcohol and his life is ruined because of taking alcohol. He doesn't listen to us, but he comes to you and miraculously he listens to you. What is the magic you do? What is it that you do? Hello and welcome to Kadabam's Insights, where serious mental health conversations happen. Today, we have a very interesting topic. The topic is about the psychological interventions, therapies for people who are going through alcohol and alcohol-related problems. To talk about it, today we have a special guest, Mrs. Aparna Rani. She finished her post-graduation in psychology with a specialization in clinical psychology. After that, she did her MPhil in clinical psychology, where she picked up all the necessary skills to help people who have psychological problems. So, she has a vast experience in the field of psychology, almost a decade that she has served people with various mental health issues. I am very happy to welcome Mrs. Aparna Rani. Hello, welcome to Kadabam's Insights, Aparna.
Hello, sir, and thank you. Thank you so much for having me here. And I think this is one of the most commonest topic that we need to address. And I think we are at the right place with the right topic. So I think
fantastic. I'm excited to have this conversation with you. The psychological interventions is extremely technical in nature, and I'll try to bring about some of the questions that many of the families and patients or people going through these issues ask us, so that I can ask you and you can help them in this area. One of the most common things that we come across, people talk to us is, Doctor, we have been advising this person to leave alcohol. We have been telling him the ill effects of alcohol and his life is ruined because of taking alcohol. He doesn't listen to us, but he comes to you and miraculously he listens to you. What is the magic you do? What is it that you do?
I think what we need to understand, not just as a mental health professional, but also as a kind of someone who cares and willing to hear the other person and not just focus that, oh, he's just drinking alcohol, rather try to focus on why is he drinking alcohol. Because I think let's put it in a very simple way that alcohol is available but not everyone is addicted. Same goes with food. I mean, food is available but not everyone is addicted with food, but it is an addiction for some of us, right? So I think instead of just telling them that, hey, don't drink alcohol or don't go to bars, I think let's try to sit with them and understand, why are you drinking? Because a lot of time that we try to understand from the mental health perspective is that, are they using it as a coping mechanism? Are they trying to deal with some of the stressors, some of the difficulties that they have been gone through? So I think when we try to understand why and not just what are you doing and just stop going to bars or stop drinking alcohol, I think that's when they feel a bit more safe, bit more heard, and also comforted that we are not just coming and questioning them or blaming them that you are just an addict or you are just completely into yourself, but we try to even help them to help yourself.
What you do as a therapist is not advising.
Absolutely not.
Okay.
I think absolutely not, because I think everyone out there is advising them, telling them, don't do this, don't do that, don't go to bars, don't drink. I think they know it. I think we all know it, that what are the side effects of alcohol, what are the side effects of anything which we consume in an excessive manner. So I think we need to hold on to that and try to understand that why. I think that why is very important.
I think this is one of the biggest misconceptions that the people have. that counseling is about advising the person, and and they feel that we have done the same thing, we have done the same
Yes.
advices, it is not working out. So it will be very interesting today to learn, understand how different these therapies are, and how you take the person with alcohol dependence or addiction go through this journey from being a person who is dependent alcohol to completely normal, or to lead to sobriety. So when a person with alcohol comes to you, okay, we see that there are people who are taking occasionally, and there are people who are taking it much more regularly, almost on a daily basis. So from a psychological point of view, what are the things that you look for when you see a person?
So if I can create a little bit difference here, as you mentioned about counseling and therapy. So when we talk about counseling, I think counseling is a milder version of therapy, if I can put it that way,
Okay.
where we try to understand the stressors, we try to provide them the emotional support, where they feel comfortable. But when we talk about it from the therapeutic perspective, I think it's more like a tailor-made process, where it's scientifically based system that we are using in a place where we need to personalize it to our patient, and understand from where they're coming, what are the difficulties that they're facing, try to elicit more in terms of their coping mechanism, their personality factor. So of course, when we talk about in terms of therapy, I think it is much more deeper, okay, where counseling focuses on the superficial level, and also try to tell them that, hey, if you think that counseling is not helping you, why don't you just go for therapy. So I think therapy is definitely much more structured, much more deeper, and also trying to understand the coping mechanism, I think, which goes long way. And that's why therapy is not something that we say that.
So if a patient or a person
Yeah.
comes to you along with the family, of course,
Yeah.
it's always with the family that these people come. When they come, what is it that you look for as a psychologist if there is a person with alcohol problem in front of you?
I think first thing, as I mentioned, I think to understand that why are they drinking.
Okay.
Not just that they are drinking. I think the one thing that they are trying to do by consuming alcohol is to feel good. I think to
Okay.
feel better. And they are just trying to deal with their pain. So I think once we start digging deeper into that, I think that's what helps them to have more sessions with them. And, they also look forward to come back to us, and they feel that, someone is actually not judging them, rather trying to help them. Yeah.
Go through this. So we see commonly that there are people who are drinking so much of alcohol, but they say that I have no problem with my alcohol, and if I want to stop alcohol, I can stop it today. And there are people who are desperate that they want to leave, but they're not able to stop taking alcohol. And there are people who have problems because of alcohol, but they are neither there nor here, kind of a thing. How do you categorize them, and how do you approach as psychologist, how do you look at these different kinds of people?
Yeah, so I think I'll go back to the therapy a little bit more, because I think there is there are few therapies, but I think one particular therapy that we talk about is motivational enhancement therapy. And I think initially when we do the clinical interview, we also do some of the psychological test assessment to understand their motivation level to come for the session, whether they are coming on their own or whether their family is, bringing them to our clinic or hospital. So I think once we dwell a bit more deeper into that, we have an understanding, and then we talk about few stages in therapy, especially from motivational interview perspective. So the first stage that we talk about is pre-contemplation.
Okay.
Where they're not willing, they are in that ambivalent stage, they are in denial. Okay. And then when we slowly shift to the second stage, where contemplation stage, where they accept.
Pre-contemplation means, I'm still contemplating whether I have
I need to seek help or not.
Okay.
Most of the time, no. But when we shift to contemplation, they accept that, yeah, I think I have stressors, I have difficulties, but I think alcohol helps me. I don't see it as a problem. So one step ahead, but still they are not very much willing to work on themselves. And then when we talk about the third stage, and that's where the preparation starts. So either they'll start looking for some right help, or they'll start looking for therapists. They might also start reading what to be done about it. So that's when they go into the third stage, what we call preparation.
Okay.
And then the fourth stage, that we call it action. So that's when actually they reach out for the professional to seek help. They might either come for even inpatient facility sometime, because if they struggle, that they might not be able to deal with it, because maybe when they have tried in the past, maybe the craving was quite strong, maybe they might have had some withdrawal symptoms due to dependency. So of course, when we see them in a clinic, we try to educate them, and when we educate, they also can relate with it, because they might have tried it on their own. Because a lot of time that patient that we get, they must have tried maybe just for a day, but they must have tried it and they have had difficulties with that. So that's where we talk about the action stage, because they are here and they are willing to work on it. So that's where also the IP care comes into the picture, where we as a mental health professional, be it psychiatrist or clinical psychologist, help them to understand that how they can be in a protective environment to work on their recovery process. And then the last stage that we talk about is maintenance.
Okay.
So once they have worked on their addiction, of course, we also need to help them how we can prevent the relapse. We can also educate them that how relapse can be part of the journey, part of the progress itself. So of course, there are few stages which we need to go a bit deeper and help them to understand so that they can help themselves.
Okay. So a person who has alcohol problems, when we, since we are talking about people with problematic alcohol, usage, so they can be in a stage where they are completely in denial to taking action that I want to get out of this problem, and seeking help. As family, how can a family help, and how can they recognize that yes, my person is in this stage, and if I little nudge him, little help him, he can move to the next stage and it might be helpful?
I think the question that you're asking, it's a bit tricky for the family members as well, because if you see it from a family member's perspective, there's a lot of emotions involved there. They're very much, concerned about their family members. So of course, when they try to help them, they go overboard. It's very difficult for them to have that boundary where, it shouldn't be like they're forcing them, they're blaming them. So I think what they can try to do is, of course, they can reach out to us if if they've already tried to tell them that, hey, let's go seek help. And if they are not willing, I think family can directly reach out to the mental health professional as well, to understand that this is what that they are going through, what needs to be done. So now coming back to what family can do, I think first thing first, give them some space. Try to, ask them that, hey, is it something that you want to talk about? Is it something that has been bothering you? Or when it comes to you drinking alcohol, what is it which is, just consuming you in that process? So whenever you feel ready, I am there to talk to you. And I think letting them know that you can take your time and I'm here, I think they'll feel a bit more comforted. Of course, we also need to understand that it's not easy for them, because they know even they are suffering, they are struggling, they are having sleep issues, they might be using alcohol just to sleep better. So I think giving them that space that I'm here, and whenever you feel ready, you can get back to me and we'll have a talk and we'll see what else needs to be done. I think that will help them to seek help a bit more.
Okay. So when should we get these people to you, for therapy or counseling? Can we get it at any stage, or is there a specific stage, like how you beautifully mentioned, there are 5, stages that this person can be, categorized into? When should they get you?
I think there's no right answer for that, I would say. I think it depends. It depends on, it varies from cases to cases. Okay, but I think whenever they are willing, I think number one.
They are willing in the sense the patient
is willing. If patient is not willing and family is observing that their functional areas are getting affected, be it personal, professional, and I think that's when they can reach out to the mental health professional, because the moment it starts affecting their functional areas, I think that's the something that is something where where we need to be more cautious and seek professional help, so that we can actually help them why they need health.
So even if somebody is not willing to accept, he is in, I think the first one that you said, the pre-contemplation, where he's not even willing to, it's
Yes.
kind of a denial that this person is. Can they get you? Can they get that person to you?
See, they can definitely get the person. There is nothing wrong with it. Of course, they might not be willing, as we discussed, okay? But I think that's when the mental health professional roles comes into the picture, and so that we can at least initiate the session and just try to understand that, okay, what brings you here? It's first thing they might tell us, my family brought me here, so I'm here. Okay, fine. Family brought you here, but what are the reason? Because your family might be concerned about you. So I think it's not something that they will not be willing to talk about it. I think when you start giving them that space, that atmosphere where we are not judging you, and even though your family brought you, we empathize with you on that, and it's definitely not easy for you to talk. I think they start opening up slowly.
Yeah,
And
because
once
the root of that question, isn't it better that when I'm met with a challenge as a family, where the person is completely unwilling to accept that I have got any kind of a problem, instead of me dealing with where I do not know what to do, and you would have seen that a lot of them, the time that they reach the professionals, the relationship would have spoiled so much because they would have tried to deal at their own level. Isn't it better the moment I, as a family person, find maybe there is some problem, I don't know, I'm not a professional, but I feel there is something which is going wrong, let it be evaluated and assessed and told to me by the professional.
Absolutely, sir. But see, it's not easy for family. I think we have. I think we also need to acknowledge that part, that a lot of time family do bring them to the hospital without their willingness. But as you correctly said, it has affected their dynamic. So it's definitely not easy for them to accept it. Why? Because we need to also understand one more factor which can be contributing in their addiction is personality.
Okay.
So there are certain personality who are susceptible to be into this whole cycle of addiction. So it's very tricky to deal with them. You need to be very mindful of what you are saying, how you are saying, so that they understand that you are not on your, because they know that your family like my family has brought me here, so they think that mental health professionals have already taken the side with my family.
Okay.
So that has already affected the dynamic between patient and the therapist or psychiatrist for that matter. So we need to be very cautious on that in terms of what are we saying, so that they feel acknowledged, they feel that their pain is valid, their anger, their resentment is valid. So I think first few session goes into that, just to make them understand that whatever you're going through is valid. And then the second part comes where we try to educate that why your family has taken that decision to bring you here, given the circumstances or the difficulties that everyone was facing as a family.
So as a family, it is better, irrespective of the stage that the person is in, whether he is in ready to take therapy or completely denying to take treatment, better to approach a mental health professional so that you can guide, if not the patient, at least the family member, how to or how not to. That's a great input, of course. A person with addiction, why does he get addicted to alcohol? Why is he not able to stop? And isn't it natural that I take alcohol and I get into trouble? I don't want to take alcohol. But here are the people who, despite having so many issues in their life, they're close to those issues, or they close their eyes and they continue to drink. Why? Why do they become addicts?
Yeah, so I think that's what I think we need to focus upon, that when we were discussing that there are few therapies, like few theories in our psychotherapy that we talk about. Is one of the commonest theories that we talk about is psychodynamic theories. So if I go by that particular approach, it says that we really need to look into their childhood or early adulthood experiences. If anyone who is having a history of any form of abuse, be it physical, sexual, emotional, or any form of neglect, they tend to have these kind of addiction bit more, because they don't know how else to deal with their pain. So basically they are addicted to numb their pain. So when they drink alcohol, they feel good. Like if I go by one of the studies, it has mentioned that, when children, while growing up, if they haven't received the kind of love, affection that they really need from their parents, their actually reward system, the brain chemistry doesn't build properly.
Okay.
They don't experience pleasurable emotions. So when they drink alcohol, or when they have a early exposure, like at a very young age, any of the substance for that matter, they feel really good. Like one of my patient told me that when I tried one of the substance for the very first time, I felt like I got a hug, like someone hugged me.
Very emotional,
Yes. So do you see from where that person is coming, where
I mean, two seemingly unrelated things of
Yes.
hug and
Yes.
alcohol.
Yes.
Very interesting.
So it's very important for us, I think, to dig deeper, to understand their emotional baggages that they might have been carrying, which they don't get to talk about because it's not easy, because while growing up, their parents were not there. So if the primary caregiver was not there to listen to them, to make them feel heard or acknowledged, how will they go out and come to any random person, be it even mental health professional for that matter? It's not easy. Of course, they were able to manage when they were living with their parents, maybe to some extent, but especially after getting married, it's like a completely different game altogether. So I think it's very important for us to understand the kind of emotional baggages or trauma that they might have gone through, because if we go into the studies, I think most of us, who's actually addicted to any form of substance for that matter, even including food, I think we all have been carrying some sort of emotional baggages, which requires more attention, more work. And that's why therapy is not something which you start, rather, which you start, because someone has brought you. Rather, it goes a long way. And that's what also helps us to prevent the relapse.
Okay.
So I think these are some of the components, especially from the personality and the
You
trauma.
started off with one of the theories of psychodynamic. I mean, is this the theory by any chance of Sigmund Freud?
Yes.
Okay.
Yes.
Great.
Yes. Yeah.
Great.
Yeah.
And what are the other reasons? Are there more theories about?
Yes, they're definitely, like as I mentioned, psychodynamic, definitely. Cognitive behavior therapy is there. Then there is a relational theories, and that's where personality plays significant role. Again,
Okay.
like for example,
Can you elaborate on maybe the other few
Yes.
Theories? It is very interesting.
Yeah. So when we talk about this relational theories, again, what kind of relation that I have developed with anything for that matter, be it substance, be it any other coping mechanism, like sometimes, for example, I'm shifting a little bit from here, like for example, sometimes harming themselves or indulging in any form of self-sabotaging behavior. Alcohol also is one of the self-sabotaging behavior. Sometimes people start cutting themselves to have a relief from. It's not like they're always wanting to die, but just to deal with that pain, because they don't know how to deal with it. So similarly, every time when they consume any form of substance, they develop their relation in a way that they feel good. Even they know it's a temporary relief, and that's why they keep on going back to drinking again and again and again.
Okay.
But that's the relation, that's the connection that they have built over the period of time, and they have felt alive because they never felt those emotions. Okay, so of course there are these theories which play significant role, and it has shaped their learning to deal with the problems in their life. So they think that they have problem, and the only solution is to drink alcohol.
No, I think the very interesting thing that you're saying, person trying to cut himself, trying to harm himself, and person trying to take alcohol, we consider both of them to be so different. We generally consider a person taking alcohol, he's taking it because of the pleasure he wants to enjoy. But the interesting analogy that you presented, you spoke about, it's very interesting that they're the same. Here is a person who is taking alcohol, destroying himself, and there's other person who is trying to harm himself by cutting his hand or doing whatever. Oh, sorry, I think I cut you short with another theory. I'm sorry. Please go on.
No, I think these are the commonmost theories. I think usually we revolve around that. But I think the basic that we need to understand, that people who are addicted to any form of substance, they want to feel alive. I think
they want to feel alive. Okay.
Yeah. I think because I have another patient who was like, oh, I always felt emotionally I was dead I never felt any emotion. But when I started drinking, I felt happiness. And in last 20 years, I never felt, if you would have asked me 20 years ago, what is happiness, I wouldn't have even described you.
Okay.
So I think when I say that, therapy is a tailor-made process, I think every person who's drinking, even their process of dealing with is also quite personal and tailor-made, that they have made it for them. So I think we need to be very mindful of, their journey and then bringing therapies accordingly.
Does family and the way they are brought up and the family environment also has an impact on somebody becoming addicted to alcohol?
Absolutely, sir. So of course, when we talk about the early childhood experiences, environment plays significant role. At the same time, genes, there are some cases that we have seen. Even if I go into we can look into the studies, and there are few people who are actually physically addicted to alcohol, not psychologically. Why? Because their parents might have been drinking, so genetically there's always a loading with alcohol. Okay. So maybe father side, mother side, when people are drinking, they are carrying the same genes in their body. So they'll say, you ask them, what are the stresses? No, I think everything is fine. I have a good life. I have a good family. I have my own business to take care and everything. But still, I can't stop drinking. I don't know why. So of course, environment does play significant role, because when we see it from a biopsychosocial model, I think everything combines all together, shapes an individual. So we cannot just ignore the environmental factor and say it has no impact. Rather, it has it has significant impact on an individual, because sometimes psychologically they are okay, not that much, traumatized, but still physically they are addicted. Okay. Just they want to drink because they feel the need to drink. So of course, environmental role, is quite significant that we need to understand.
You mentioned about biopsychosocial. Can you elaborate on what do you mean, and something which we need clarity is physically addicted, psychologically addicted. Are they two different things?
Pardon?
Are they two different things that physically being addicted and psychologically being addicted, are they two different things?
Not entirely. It overlaps. So that's why when you asked me about the environmental, I also try to bring some of the genetical component, because when we see it from a biopsychosocial model, biological component basically focuses on the genes, the neurotransmitters, the brain chemistry, the reward system. Okay, now when we move to psychological model, of course it has more to do with the way we think, the way we perceive, the way we deal with our stressors, our coping mechanism, our personality, everything comes into that. And when we talk about from the social model, of course, our family, our support system, our peer group, our society, the kind of difficulties that we might have had, our workplace, everything. So everything combined together. That's why also it gets a bit tricky in our mental health to say this is the only reason why you are suffering from so and so, because it's a model, and all these model carrying so many multiple factors inside that which plays significant role. So when we see it again from the holistic perspective, that's when the biopsychosocial model comes into the picture, which helps us to understand, the addiction bit better, and then again make a holistic approach to treat it along with the medication, not just therapy. So that's how the biopsychosocial model plays significant role, so that we include medication along with therapy, with yoga, physical activities, everything comes all together and plays significant role to help a person to recover from their addiction.
From the time we started our conversation, this conversation I'm talking about, I was counting, this is the fourth time, that you have used the word coping.
Yes.
Okay.
Yes.
Generally, we understand coping to be, I'm coping with this, which means I'm kind of bearing with this. Okay. Is that the correct understanding? Please help us understand, what do you mean by coping, and are there different coping mechanisms or coping ways that people have?
Yeah, so when we see it from a therapeutic perspective, of course, coping has a larger meaning here. Like, for example, my way of coping with stresses is just going for meditation, sitting on my own. Okay, maybe where other person feel like, oh, the work was quite hectic today, let me just grab a beer. Okay. So again,
so it's the way I deal with
the situation,
unpleasant or a stressful situation.
Yes. Okay. So again, as per the person, their coping mechanism will be different. Now, if you see it from an addiction perspective, we also need to understand, because people might have developed their own coping mechanism which might be biased or distorted in some way. Okay, so that's when the other therapy comes into the picture, cognitive behavior therapy. So I think that's where we focus on the cognitive distortions. Or to put it in a simple way, what we call it, biasness or errors in our thinking pattern. For example, we say that, oh, my day was good, or it was extremely bad. So we always function into extreme, what we call it, black and white thinking. Like, for example, if I relate it with alcohol, like either I'm not drinking, or I'm drinking too much, what we call binge drinking, that I couldn't control. And a lot of cases comes with that binge drinking pattern as well. So that's where the black and white biasness or coping mechanism comes into the picture.
I mean, the two extremes you're saying.
Yes. So like this, there are many more, like magnification, minimization. I'm magnifying maybe one thing which didn't go well as per my plan or schedule, and now my whole day is disrupted because I'm just focusing on that one concern.
These are the different coping strategies that you're talking about, or this is the thinking style which can lead to problems, you're saying?
So thinking style can actually impact your coping mechanism. So these two may overlap most of the time. So that's why when we say coping mechanism, when we actually sit with patients, we need to explore their coping mechanism. And when we start exploring, we see all these cognitive errors which are present there and coloring their coping mechanism in a way. So basically, coping mechanism which is colored, or actually, in a way.
Are there different types of coping mechanisms?
Again, it's very tricky. That's what I was telling, that of course there is healthy, unhealthy coping mechanism.
Very broad. Yeah.
So again, when we talk about healthy coping mechanism briefly, like, having, maybe half an hour just for yourself to unwind, to relax yourself. Just going for a walk, connecting with your loved ones, maybe expressing your mind out, maybe indulging into journaling where you are letting your thoughts, emotions out and also processing it. So these are some of the things which we talk about, healthy coping mechanism, which helps us on day-to-day basis to regulate our emotions a bit better. When we see it from an unhealthy coping mechanism, like these days everyone is hooked to their phone. The moment they get time to distract themselves, to feel better, so using phone can be also an addiction. And of course, maybe just scrolling on social media. When I say phone, as in, they're doing it quite mindlessly.
Yes.
They don't know, if you actually look at their screen time, to be like 3 hours, 4 hours. So similarly, when people go for drinking, they might have said, okay, I'll just have one drink. And we always say it's a quite slippery slope. Once you're there, there's no
one drink there.
Yes, you will slip in that. So that again comes under unhealthy coping mechanism. Sometimes maybe having anger outburst, because maybe they might had a bad day at work. They come back home and just start screaming at their children, towards their spouse, partner. So a lot of these things comes under unhealthy coping mechanism, or the best unhealthy coping mechanism is just put everything in a container and just throw it. So suppress all your emotion, go back to drinking, feel a bit better, and then continue the same cycle. So these are some of the healthy, unhealthy coping mechanism that we need to explore.
Okay, interesting. Some of the things that you're talking about, black and white and magnifying. I think we also see that in our day-to-day life, that as a person, we feel, oh, it is such a small, silly issue. Why is he worried so much? But for him, it is a big problem that he is going through. Are there different types of people, when I say people, personalities, who are prone to this alcohol addiction?
Yes, there are few personality definitely who are more susceptible, who are more prone to alcohol addiction or any other form of addiction for that matter. I think one of the commonest that we get to see is cluster B personality. Of course, under cluster B, there are few subtypes. Not every
cluster
subtype.
B is a type of a personality.
So there are a few clusters that we talk about, like cluster A, cluster B, and cluster C.
Okay.
I will not go into the details of
yes,
that.
Yes.
But coming back to cluster B personality, so some of the subtypes, like impulsive personality, because they need immediate gratification. So when they are under a lot of stress, when they are overwhelmed, they need to calm down, and that's when they grab a drink. So impulsive personality is quite susceptible. Borderline personality is also quite susceptible, and that's when they indulge a lot in self-sabotaging behavior. And then there is another cluster that we talk about as cluster C.
Okay.
Now, one of the personality, what we call it, anxious avoidant personality.
Okay.
So whenever they feel anxious, they will try to avoid that particular situation at any cost. So they will go and drink alcohol because they have avoided every problems in their head and now they are feeling absolutely fantastic. But what they don't realize is that unconsciously or unintentionally, they are creating a cycle which they will get stuck into, and it will take a lot more time, effort for them to come out. So, of course, there are few more personalities, which are quite, prone to, dwell into these addictions.
Yes, I think we also see people who are very anxious, or there is a situation where you're not able to face, and that will lead to a lot of anxiety. When you're supposed to face that situation, you just go and grab a drink, or under the influence of alcohol, you go and face the situation. So, are there these kind of psychiatric problems or issues that can also push an individual to alcohol addiction?
Yes.
And how important are they for you as a psychologist or a therapist?
Absolutely. I think there are, especially when we see it from a mood disorder perspective, I think that's where we need to be more mindful of, again, exploring these coping mechanisms where they can be using alcohol as a coping, system in their life. And when I say mood disorder, basically I'm talking about depression, anxiety. It can be bipolar as well, because again, where we experience two extremes of mood symptoms. So of course, there are few psychiatric conditions, especially depression and anxiety, because it basically helps them to subside their pain. So the receptors are numb. So they are feeling a lot better. So of course, when we see it from a depression, anxiety perspective, especially mood disorder, I think these are the few disorders where people tend to lean more towards any form of addiction, especially alcohol.
Great. Now that we have spoken, what causes this alcohol from a psychologist point of view, and as a psychologist or as a therapist, what are the things that you look at it? It is mind-boggling to say, and so many aspects and so many domains, that you have to explore. Naturally, you can't do it in one session, 1 hour 45 minutes. I know. You need to spend the time with the person as well as the family. When you are helping an individual, when you are doing therapy, how do you help? What are the different therapies that will be helpful? I think you did briefly touch upon the motivational enhancement therapy, motivational interview. What are the most effective, successful therapies that are known, and what are your favorites also, we would like to know?
Yeah, I think cognitive behavior therapy along with motivational interviewing is one of the common most used therapy. And if I go by the data, I think somewhere around 46% that it helps in an individual's journey to come out of this alcohol. So again, when you ask me what is my favorite personal, I think I'm someone who's always into an eclectic approach where I make it more like a tailor-made process. So not just restricting myself to cognitive behavior therapy, to motivational interviewing, but also going into the past, where exploring the traumatic experiences, and that's where the trauma-focused approach also comes and plays significant role. So again, It's more like an eclectic process depending on the individual that we are in.
Okay. So what are the different therapies? And a psychiatrist, when we ask them, when we talk to them as to somebody with alcohol addiction comes to you, they have diagnosis the way you are saying from a psychological domain, how you diagnose. They have certain anti-craving medications, some medicines which help in deterrence of that individual. Okay. So what are those different therapies that you do? Help us understand a little bit.
So again, when we talk about the motivational interview, I think we need to go into a bit deeper to understand their motivation. We explore all these stages to help them understand stages of contemplation, like pre-contemplation, contemplation, preparation, action, maintenance. So again, we need to understand where the person is standing at the moment, what else we need to do so that person takes one step forward and come to the another stage. So of course, we focus more on that. At the same time, we also try to help them to understand their way of coping or functioning in their life, and how they can try to modify some of their coping skills that they have been using, which is clearly not working out for them. And I think once we identify that with them, where we ask their personal experiences, examples from their life, and once they start reflecting upon it, I think it's a lot more easier for them to dwell into these therapeutic journey, where the CBT becomes quite effective, because now they are becoming more and more aware of their own thinking pattern. Because I think we all have these biasness. When I talk about personalization and blame, if someone said, hey, your work is not good, the person is thinking, oh, I am not good enough, I don't know, this person insulted me. They feel a lot of shame, guilt and everything, right? So of course, when we dwell deeper into it, we understand that the kind of distortions that they have been using, and the way they have been coping up with their day-to-day struggles. And once they are able to reflect upon, I think we have a better hold on to the therapeutic session, where they also start feeling that, yeah, I think I'm not able to take things personally. I'm not looking for immediate gratification. I understand that there are many other ways which is going to help me to regulate my emotions a bit better. Because one of the important thing that we also talk about is that they're already aware, but when we emphasize on that, they do agree with it, that alcohol helps you to feel a lot better when you start drinking it, but slowly it also start acting as a depressant. So that's why, when people have 1 or 2 drinks, they'll feel happy. They'll start talking about their life. All the inhibitions are, gone. They'll start dancing, cheering, everything. And, once they have few more pegs, and then they'll start crying, talking about their heartbreak, whatnot. So, of course, when we give such insights which they can relate with from their life, I think that's where the therapeutic process becomes quite relatable and a lot more easier for them to show up for the therapy sessions.
Okay. So when you spoke about the motivational interview, and also you said motivational enhancement therapy, are they different?
Not entirely. So when we do the motivational interviewing, basically we understand where do they stand, their willingness, how much are they ready, the denial, the difficulties. And when we talk about motivational enhancement, so once we have identified those core components of the difficulties, that's when we go into the therapies, the further stages, and help them again, to work on their coping skills and day-to-day life challenges.
Okay. And about the cognitive behavior therapy, which is so much spoken about, and everybody says, I am aware of CBT, or I've heard of CBT, and they talk about it. Yeah. What is it? What is it in the context of alcohol dependence or alcohol addiction?
Yeah. So I think these days everything is available on internet, good way, in a good way, but in also I think it has a lot of cons of it, because what happened, they start reading it and implementing it on their own without having the depth understanding of it. Okay, so when they come for the session, and when we ask them, oh, don't try CBT with me, I've already tried that. Okay, so when we say, okay, tell me what the 5 basic skills that you have tried from CBT. Oh, name I don't remember. Okay, or what are these skills? Maybe, going for yoga, going for meditation, going for run, trying to work on my thinking process. So they give such vague answer, but if you actually say, okay, when you say yoga, when you say pranayam, when you say physical activities, when you say that even the cognitive behavior therapy skills, give me something specific, they struggle, they fail to give us those explanations, because they cannot understand that when we say that, okay, cognitive behavior, it has 2 components. One is cognition, the way we think, the way we deal with stuff as in the way we deal with our problems, and then how it impacts our behavioral aspects of an individual. But they will say, oh, behavioral means, okay, I just need to focus on the physical activity. Same thing you're gonna tell me, so I need to have a better routine. Oh, I have tried everything, it doesn't work. So I think helping them to educate them that how cognition and behavior is interconnected, because as per cognitive behavior therapy, one of the basic principles that we talk about is the way we think, we start feeling. Okay. And if we are feeling certain way, the same feeling is going to direct our behavior. So basically our behavior is governed by our thought process. So it's a whole lot of process which we need to go into, dive deeper and understand the cognition, how is it impacting the behavioral, and that's where also the coping mechanism, again I'm using the word, but yeah, that's where, again it starts impacting. So it's not that simple the way it sounds. I know a lot of time we say, oh, cognition, behavior. No, it's not that easy. I think we all know, and that's what I said. Alcohol is available everywhere. Not every one of us are addicted. Food is available everywhere. Not, again, every one of us are addicted. Ice cream, sweets. Certain people who are addicted to it. So again, going back to the basic will help us to, choose these therapy and go into the depth and help a person.
Now I can understand. I think you beautifully explained. If I can rephrase or repeat what you said, alcohol is a behavior, alcohol addiction or dependency is a behavior, and that behavior has come because there is some kind of a feeling that I have, and that feeling has come because of the way I have thought or the way I am thinking, and until and unless that thought or the reason thinking is addressed, this behavior is never going to change. And that is what you do. You have done it for the last decade. These people with alcohol, many of them wouldn't like to be considered or called as patients. They feel it is a habit which has gone out of control and I want to manage, which means I want to come to you and just consult you and take the help. But there are people who have so much of problem that you can't have them at home and just treat them. And also we see there are a lot of people who are so dependent that they need little longer duration of treatment. So we did speak about the different treatment settings in our last podcast with Dr. Madhukar, where he was talking about outpatient treatment, inpatient treatment, and then the de-addiction centers where there is a program-based de-addiction to help these people get into or become sober. From a psychologist point of view, how do you see these settings and what is your role and how do you help them?
Yeah, so I think when we talk about from OPD perspective, I think we focus on the presenting concerns, we try to educate them, we try to help them identify their struggles, their barriers, and try to build a coping mechanism. That's all what we can do along with the family support system. Okay, but when we find it that they're struggling to manage it, because as we were discussing that even environment plays significant role. So if they have maybe interpersonal issues at home with their family members, with their loved ones, it's difficult for them to continue the treatment or to make progress just based on the OPD treatment. So that's when we recommend the IP care, and that's what Dr. Madhukar mentioned as well. So when we see it from inpatient setting, the treatment also become bit more intensive, where we have regular sessions. We can involve family members to have a family session. We can also start the group therapy in an inpatient setting. So of course, when we shift from OPD to inpatient, it become bit more intensive. And similarly, when we see that okay, they've stayed here maybe for a week or 2 weeks time, but still they need to sustain the recovery, they need to sustain the progress that they have maintained. And that's where we talk about the de-addiction center, because once we step into the de-addiction center, a whole lot of activities comes into the picture, like starting from the behavioral schedules, having their day-to-day life routine, putting them into a structure, group therapies, yoga, meditation, and help them to feel more confident to sustain that progress that they have made so far. So of course, all three aspects of treatment plays significant role, and it helps a person to sustain the progress they have been wanting to go ahead with.
So you, as a therapist, would your role be very different if you're seeing a person in outpatient setting to an inpatient setting to a de-addiction center?
To some extent, that's what. So
okay.
When we talk about OPD, we focus on the basics. Okay, but when we talk about the inpatient, it becomes a bit more intensive, because we are not just focusing on the patient, but we are also focusing on their spouse, their family members.
The reason I'm asking this is, can a person who has alcohol problem come to you on an outpatient basis, take therapy and become sober?
No, that's what it has, many challenges.
Okay.
Because IPR issues, the protective environment is not present. But when they go back, maybe when they are with me in the session, they are absolutely fine. They are all confident. The moment they step out, they see a bar, they see some club. They might feel like going. The cravings might increases. So of course, dealing such cases based on the severity, we need to take calls whether we need to treat them on OPD basis, inpatient, or also recommend for further rehabilitation care. So it all depends on the severity of an individual, but that's what, again, if we see it from a clinical psychologist perspective, the role differs slightly. Because when I'm having one-on-one session, I'm just working with patient. I don't have any family members involved, where family plays significant role because they are the support system. They are the network where they are living 24/7. So of course, when we move further from OPD to inpatient setting, family becomes a bit more active because they are coming for the session. We can have, in a way, if I can put it, a better hold on to the family as well, and work on their primary concerns, their interpersonal issues. So of course, the role of profession also becomes a bit more intensive. So of course, when we shift again from inpatient to rehabilitation center, the group therapy starts taking place. A lot more activities along with that, their hobbies if they want to work on that. So all these things, play significant role. So even the role of professional gets more intensive at every phases of their treatment.
As therapists, do you also need to work with families?
Yes, absolutely, because a lot of issues starts from family. For example, if I can give one of the example that I have encountered while working with family, where family told me that, I give him alcohol in a very supervised or monitored way at home.
Okay.
So I don't let him go out. And then we were like, oh, but you brought him here for abstinent, where we are not going to give him alcohol for next maybe 7 days or 70 days. Depending on the severity. But if you have been giving alcohol, even though in a supervised manner, in a way you have been reinforcing that patient behavior, which will lead to addiction. Okay, so it's not that easy when we work with family, because if we just leave them, the chance of relapse sometime also be a bit more higher. So of course we need to involve family to understand from where they are coming, because sometimes parents drink. Okay,
yes.
And I think we all need to acknowledge that that when parents are drinking, children are learning from the home, whatever they are learning. I think that's the first institute that we need to acknowledge. So if they are seeing their parents drinking, they'll also start drinking. Maybe their parents might have a better control. Let's not deny that either. But how will they understand? How will a child or a teenager understand that, okay, here is the full stop that I need to put? So it's very important for us to involve the family and work with them to psychoeducate them to understand how they can play a bit more significant role, because they are, I think, one of the biggest support system that we need to take care of.
Since the alcohol problem is so widespread, in the sense there are so many domains, or the so many aspects of family, individual personality, genes. I can imagine the work that you people as therapists have to do. It has to be so vast. It can't be focused just like prescribing a pill and sending the person off. You have to work with family equally, if not more, the way you work with the client. And these people who take alcohol do relapse. They might have abstained themselves from taking alcohol for months or years, but they do get back to the same habit. Are there psychological reasons why these people get back? And as therapists, how do you help them?
Yes, I absolutely agreed with what you just said. They do relapse, and I think that is also one of the basic component that we need to focus upon while working with patient, that relapse is a part of the progress. Okay, relapse.
I like what you said. Relapse is part of the progress that they are making.
Yes.
Okay.
So I think, helping them to be more equipped to deal with relapse, because that's where the relapse prevention therapy comes into the picture as well. But I think helping them to understand that just because, you have had one slip doesn't mean you need to go back. You can reach out to us and, we can again resume the therapy session, because there are times when we terminate some of the therapy sessions because they are maintaining well for maybe 6 months, for a year altogether. Though we do recommend that OPD follow-up needs to be done even once the rehabilitation care or the de-addiction center part is done. So why? Because we need to sustain the progress that you have made so far, either by staying for a month or 6 months or maybe sometime even a year for all together. So I think focusing on that part, that relapse may take place, but we don't have to again go back to the same rut from where we have come out. And helping them to understand what are the few skills, because we don't know how the life is going to take turn in their personal surroundings, because maybe sometimes some emotional trauma, some trigger, like sometimes it can be a very simple trigger. Let's say when they are going on a road and then they see a billboard of some alcohol, something which has opened recently, and they might feel like, oh, let me just step into, because I have been maintaining my sobriety for last 1 year, let me just have one drink, and then they are just completely slipped into that process. So I think helping them to understand that this may take place, but try to have the power over your addiction. And I think that is very important, because once they get addicted, it's very difficult for them to understand that they have any power on it. Okay, so I think the power of addiction, or the addiction as power, I think we need to understand on that part as well, and help them to understand that how they can prevent relapse. Even if they fail, that is fine. Failure is a part of the progress. And then what are the steps that we need to resume to sustain the progress which we have done quite some time ago.
Wonderful. Alcohol, people who are taking alcohol, one of the most common things that we see is abuse. Abusing the other individual, be it physical or emotional. How frequent, how common is it when you are doing therapy, especially with the spouses that you attend to? How frequent and how common is it to see this kind of an abuse, and how do you help them? It is so traumatic that it could be husband who is kind of physically abusing under the influence of alcohol, or it could be the wife who has gotten into substance, alcohol, and completely neglecting the family and children. How frequent and how do you help them?
Yeah, so absolutely. We have had few cases where even women were addicted to alcohol, given men is busy working, making money. Of course, they have their own set of responsibility towards the family, and sometimes they lose out on giving time to family. So of course, we have those cases as well. Coming back to the abuse part, I think it happens from both the sides. Okay, of course, a person who's drinking, they can be bit more abusive because they are under the influence of alcohol, and given some personality factors, they can also be at a better place where they can be abusive, if I can put it that way. Why? Because they have those personality, and if under the influence of alcohol, their judgment is completely impaired. So if a family members think, okay, I will not give them the alcohol, they might just get irritated, agitated, they might throw things. Sometimes they can be physically aggressive, emotionally, verbally. Definitely, I think that's the most common form of abuse that we get to see, where they can be verbally quite aggressive towards their loved ones or the care provider. But physical abuse still not that common, I would say. But again, if they are under the influence, since their judgment is impaired, and if their cravings are quite significant, they don't care who's standing right in front of them. They can go to any extent to seek alcohol at any cost, and that's when they cross the line and become quite abusive towards their family. And once they become abusive, we have also, if I can add the second part, and that's when family has reached out directly to the facility and saying that we would need admission because he or she is a threat. So of course that takes a different toll altogether, and then we need to proceed further from there by admitting them in IP patient and then further care in the de-addiction center.
Great. It was very interesting, the conversation today about the psychological aspects of alcohol. We started off with what is it that means to be called as therapy, and to different stages that individuals can be categorized, and how to help them, the different psychological therapies that you people employ, and how as psychologists you look at a patient. And it's, as I said again, it's mind-boggling to understand the so many aspects of an individual that you people explore, and the way you've explained to us, very crisp and to the point, and very articulate, I have to say. It was wonderful, having this interaction with you. And something that as a message that I take back is there are therapies, there are scientific support systems that is available, and at any stage any person feels that they have problem, they just have to approach the mental health professionals, and help is available. And most importantly, relapse is part of the recovery process that people can go through. Thank you so much, Aparna, for this wonderful conversation today.
Thank you so much for having here. Yeah, thank you.